Lewy body dementia is an area that's been really under-recognized. Us as neurologists, we often see people with mental changes, and while Alzheimer's disease is certainly very common, we increasingly recognize that there's a large number of people who have Lewy body involvement, and that this under-recognized area, that these folks are not getting the diagnosis that's exactly accurate, that they're not necessarily getting the best treatments, and that their families and friends and other physicians aren't as aware of what they're dealing with as a disorder. So it's important for us to recognize that Lewy body dementia is the second most common degenerative dementia in the elderly, and that we promote a greater understanding of it.
I agree with Dr. Honig. It's extremely important to families to be able to make a proper diagnosis, and I think we as clinicians recognize how difficult it is to have both motoric symptoms and cognitive symptoms at the same time. And I think both of us have a long tradition of studying the cognitive aspects of neurodegenerative diseases, particularly movement disorders, and we recognize how important the cognitive changes are in these disorders.
In general, we aim to increase the awareness of Lewy body disease, improve the diagnosis of Lewy body disease, and ultimately work for more effective treatments for this disorder. And our work in particular in this NIH-funded mechanism that we're here to discuss today is involved in trying to discover new markers, new genes and forms of genes that might inform risk and might be relevant as targets for therapy for Lewy body disease. So I think our work is important in both trying to diagnose it better and in terms of coming up with better treatments for this disorder.
And I would say that we're addressing many of the recommendations by the NAPA 2016 panel, in particular following patients with Lewy body disorders longitudinally, addressing the genetics of the disease, and I think we will certainly be able to tease apart some of the changes that are associated with Alzheimer's disease and those that are directly related to Lewy body disease.
Right now, giving people a diagnosis that's accurate is very helpful. Increasingly, people want to know what they have and want to make sure they're taking the right medications for what they have. A diagnosis of Lewy body dementia conveys a different prognosis, different aspects that may come up in the future, and has different treatment aspects than a diagnosis of pure Alzheimer's disease, for example. And so it's important for us to go and help our patients understand what they're suffering from and provide the best treatment to them.
I think in designing clinical trials, we need to be able to have the populations that are most suited to a particular treatment. And as clinicians, we know how difficult it is to make the diagnosis, and we know how common Alzheimer's pathology is. And the goal of our study is to really be able to tease out the Alzheimer's versus the Lewy body pathology. And by doing so, hopefully we can have studies that have smaller numbers of patients who may really actually respond to the treatment, which will be targeted specifically against Lewy bodies.
Well, this project involves two components. One is collecting data on people with Lewy body disease so that we can better understand the course and progression and establish biomarkers, aspects of that disease progression in patients. And the other aspect is more discovery and exploratory and relates to using established resources to try to understand better what's going on in Lewy body disease and come up with better treatments.
I think we want to identify dementia with Lewy bodies in a diverse population, particularly in our minority populations that we serve, where it has not been identified to the extent that it should be, given how common it is. I think our ultimate goal is to have a biomarker, perhaps blood, perhaps spinal fluid, that is really sensitive and very specific for DLB, so that we can identify these patients early, hopefully enter them into trials, and perhaps also identify biomarkers that are associated with the progression of the disease.
Well, I'm hopeful that we will indeed just as we discussed, come up with markers that can actually allow us to identify more certainly and earlier Lewy body disorders, and that those markers also help us come up with new potential therapies that we can study and hopefully establish as to slow down or stop the progression of these diseases. So I think right now it's relatively early, but we are very hopeful that we'll be making significant progress with this mechanism.
I agree completely, and I think what we're most encouraged by is that NINDS is putting the funding behind this project and others in the dementia with Lewy body spectrum, because it's been long overdue. And it's a difficult disease to treat, and it's important that we tease these aspects apart and that we develop treatments that will help these patients who certainly need it.